Hello and welcome to On Point. I'm Lodin. The measles outbreak that started in December is quickly spreading. California has reported more than 100 measles cases since then. Cases have also been reported in 17 other states. Because of these reports, vaccination debates are resurfacing in the media. A recent report by Pew Research shows 83% of Americans believe the measles vaccine is safe for children. Federal health officials say Americans should get vaccinated.
I think the president's views on this are clear, and he, if given the opportunity to do so, he will repeat his urgent guidance that parents across the country have a responsibility to get their kids vaccinated against the measles.
You want to be making sure your own children are vaccinated, but also it's important to have those around them vaccinated.
However, not everyone agrees with this belief. Another study shows young adults are more likely to support parents making a decision to vaccinate their child rather than being required to. At Cal State Northridge, students have differing opinions.
I believe that it's up to the parents and it's their decision, it's their child, and that responsibility is on them.
I think it should be a mandatory government thing because I feel like it should be a rule for everyone, because if one person doesn't get vaccinated, that one person could be the person that infects your child and then it's going to spread. But if everyone does get the vaccination, then there's a less risk of something bad happening like it has lately.
Dr. Patrick Bennett is a licensed chiropractor who believes vaccination is not the right decision and can even be harmful to children. On Point's Teresa Arevalo spoke with him about his decisions.
Have you always felt this way about vaccines, or did this change during your lifetime?
When I was in chiropractic school, one of my fellow students, he gave me a book on vaccines. And at that point in time, just like most of everybody in this world, they know that you have to vaccinate, you have to vaccinate. And that's exactly where my position was as far as my philosophy. I literally told him, I was like, well, how can you not vaccinate your kids? That's crazy, that's insane. You're just setting them up for failure. And he was like, just please be open-minded. He gave me a book, really short read, that was well documented as far as scientific on what is in a vaccine, how it works, how it doesn't work, things of that nature. And once I read through that, it just, again, sparked my interest to do further research, more research. And then probably several years later, that's when we had our first child. And at that point, we were convinced with doing as much research as we've done that vaccines weren't philosophically right and sound with the way we wanted to raise our family. As a chiropractor, not only a parent, but as a chiropractor, we believe in an all-natural lifestyle. Everybody needs to build up their immune system as naturally as possible. That's how you harbor a strengthened immune system, so that no matter what cell, whatever germ out there, whether it's a measles, mumps, anything for that matter, you have the armor to fight off those foreign invaders that are trying to attempt to come in.
Since the outbreak of the measles, you've come forward, and have you received any criticism, and what do you have to say to your critics?
The most important thing to understand is, again, a lot of people spout a lot of things, but they have nothing to back it up with. And everything that we spout to our patients, I can back it up with scientific data. Bottom line is, everyone's entitled to their opinion, obviously. But it's super important to at least come at any conversation or debate with some education behind that, and that's the most important thing. Again, my job is not to tell you not to vaccinate your child. That is 100% a personal freedom, still to this day. Hopefully it stays that way. That's the whole goal.
Teresa Arevalo has more on the story.
Thank you, Wahid. I'm here today with Mikhaela Cielo, who specializes in pediatric infectious disease medicine at LA County USC, and Dr. Kaitlin O'Keefe, an assistant professor in the Department of Health Science at California State University, Northridge. Welcome.
Thank you.
Dr. O'Keefe, currently there is a mistrust in the effectiveness of vaccines, resulting in an anti-vaccination movement. Some say they do more harm than good. Can you explain the background behind the anti-vaccination movement and how it started?
Absolutely. So there's actually been kind of this idea of antitrust or mistrust for vaccines for quite some time, so going back to some of the earliest vaccinations. So we've really seen a dramatic increase. We saw an increase in the 70s with a vaccine, which I'm sure we'll get to, and then we've seen a dramatic increase in vaccine mistrust and kind of this idea of certain links to certain diseases that aren't necessarily entirely accurate, beginning in 1998 with a study that was published in The Lancet that's by Dr. Andrew Wakefield, who really kind of initiated this discussion of this link between vaccines and autism. So he was specifically looking at the MMR, or the measles, mumps, and rubella vaccine, and he did a very small study on, I believe it was 12 children, that he kind of theorized or reported parents' attitudes that it might have some link between these children who several of them did have autism or kind of initially reported to have autism, and then parents believed it had something to do or possibly had something to do with this MMR vaccine. So from that, there were a lot of debates that spurred after that about this relationship between vaccines and autism. You know, and we'll talk about a lot of what that has to do with, I'm sure, today, but a lot of it we've seen an increase since that time. So there was dramatic declines in vaccines, several countries. So, you know, the study was in, I believe, the UK, and we saw dramatic declines in vaccination, not, you know, entirely, but I think dropped down to around from in the 90s to around 80% in certain years. They've definitely climbed back up since then, but, you know, media coverage after then and different theories after then has, you know, made the discussion even more heated. So.
Okay. This question is for both of you. We'll start with Dr. Cielo. With the recent measles outbreak, do you feel vaccines should be mandatory?
That's a good question, and I know there are definitely moves toward that, and there are individual practices out there that they require vaccines to be a member of their pediatric practice. So I definitely think we should urge for as high of rates of vaccination as possible. I hesitate to come out too strongly toward saying it's absolutely mandatory, only because as pediatricians, we're trying to work to build a trust relationship with our parents, the parents of our patients. And if we don't try to work with them and try to educate them and do a little bit of a give and take, we might lose them altogether as patients, and that won't end up increasing vaccination.
And how do you feel?
So I think, you know, Dr. Cielo brings up a lot of good points in that the idea of kind of health promotion and education and public health should really be kind of less focused on forcing and more kind of educating so people opt into it themselves. So I think kind of requiring someone will, especially kind of in the environment today with coverage on kind of that personal freedom issue versus, you know, the public health issue, I think it might do in some ways more harm than good if we start the conversation that way. So kind of this attitude of forcing by mandatorily requiring. But on the other hand, I think health education, vaccines, and vaccine rates we should be pushing to improve those. So I think one of the best ways would probably be to educate everyone, really get the word out of, you know, actual information, scientific studies, things that have been, you know, providing evidence towards, you know, the safety and efficacy of a lot of the vaccines out there. So really kind of getting the word out about the benefits and hoping people will opt in and providing access to people who might otherwise be resource limited to have those opportunities.
Dr. O'Keefe, some people do not know the science behind vaccines. Can you explain how they work?
I can explain a little bit, but I might defer a little bit to Dr. Cielo. So, you know, we have multiple different, and one important point of vaccines, we have multiple different types of vaccines. So there's the inactivated vaccines, which are more of kind of a killed form of the whatever's going into it. So virus, bacteria, kind of components of those. Then we have a live attenuated vaccine. So it's important when people hear that word live, they think, oh no, they're, you know, giving me disease. But really that attenuated word is what people tend to kind of brush over, and really that's indicating that it's a weakened form of whatever they're giving. So, you know, a lot of the live attenuated, and we have both vaccines that we give frequently here, but the live attenuated form is weakened. It's not meant to, it's not supposed to, and most often it does not give anywhere near the symptoms of actual disease. So it's meant for the body to have that kind of buildup of immunity against it. So, and I'll kind of defer to Dr. Cielo to discuss more.
Do you want me to add?
Please.
So I think you're exactly accurate, but the basic idea is that you're taking an antigen, you're taking a germ and exposing it to the patient's immune system in a safe way such that the patient is not going to become ill, but you're stimulating an immune response and therefore a memory of that disease that entity, so that when they're exposed to that on a future occasion, their body already knows how to mount a response to it and they won't become ill in the future.
Dr. O'Keefe, herd immunity is an approach to help stop the spread of disease in a community. Will you explain how herd immunity works?
Absolutely. So the idea of herd immunity, and really kind of the whole basis of it, is not 100% of people in the community need to be necessarily vaccinated in order for a community to be protected. So one of the best things about vaccination, if enough people have kind of immunity to it through vaccination, so they're able to protect other members of the community who might be susceptible to disease, whether they're unvaccinated for safety reasons in that they might be allergic to the vaccine or might not be able to get it, might be too young to get certain vaccines. The level of immunity that the rest of the community might possess will hopefully protect them. So it works differently with different diseases, and there's different levels needed of a kind of immunity level for people in a community to have in order to kind of get to this level of herd immunity. And it really relates to a concept called the basic reproductive number. So certain diseases we know, and the concept of a basic reproductive number is how many people that one kind of typical case of disease is likely to spread disease to. So could be 1, could be 2, could be 15. So that's directly kind of interacting with what levels of immunity that we need in a community to make kind of the other members less likely to come into contact. So herd immunity is this idea that if enough people have immunity, the people who might be susceptible are less likely to come into contact with anyone who travels into the community with a potentially active case of disease. They're less likely to come into contact with those susceptibles because enough people are immune around them. So for something like, measles, for example, measles has an incredibly high basic reproductive number of around 12 to 18. So one typical case of disease in a wholly susceptible population is estimated to infect about 12 to 18 people. So we need really high levels of immunity in the population in order for us to reach those herd immunity levels. So I believe with measles it's around 85 to as high as 95% in a lot of communities that is necessary for everyone to be, or for 95% of the population to be vaccinated to reach these levels.
Okay. Dr. Cielo, as she stated, the measles, can you explain the extreme rise in current cases of the measles within the current year from previous years?
Sure. Well, I think specifically speaking about 2015, what's been in the news is the case that came from Disneyland. So what happened was just what we were speaking about, the fact that if your herd immunity in your group of people drops below a certain critical point, then a lot more people are going to be susceptible, meaning the vaccination rates are lower than you'd like them to be. And with our intermixing of population, it's so frequent to travel these days. People travel all the time. And you have people who are coming from countries who don't have as high of vaccination rates as even we have here. We're talking about our vaccination rates being suboptimal. There are many countries in the world that have even lower vaccination rates. So when you have people coming over from other countries and then visiting a crowded location such as Disneyland, then it just is taking the perfect ingredients, the perfect storm of situation to cause an outbreak. And so I think a lot of the cases that we're seeing recently, or a lot of what you're hearing reported on the news, is directly stemming from this Southern California case where they believe, I don't think they've fully identified who it is, but they believe it was a foreign visitor to Disneyland who then sort of spread it, like you were saying, the 12 to 18 people, who then could continue to spread it. So then it sort of increases exponentially from there. So that's where it's coming from. It's coming from somebody who had measles, who spread it, which it's very easy to spread because it's just, airborne, these tiny little droplets that can be lingering in the air for many hours after the person has left. So that's where it came from, was from the initial source case who infected susceptible people.
Okay. Dr. Cielo, how do you address parents that are hesitant to vaccinate their child to follow the recommended guidelines?
That's a great question. As I was mentioning earlier, I really try to work with them. A lot of times it's just a simple misunderstanding. They just don't have the appropriate information. They've heard something on, the news, or they've read something online and they just don't have the right information. Or maybe they've even just heard something from a friend, or they report, oh, I know so-and-so and this happened to them. So a lot of their hesitancy can be solved actually quite easily if you just ask the question. So what is your hesitancy? Why don't you want to vaccinate? What are you concerned about with this particular vaccine? And just try to delve in a little bit and answer their questions as much as you can. Sometimes even when you get past that point, I'd say a lot of people, more than 50% of people, if you answer those questions, you can actually get them to vaccinate. So it's actually not as hard as one would think. But for those who are a little bit more determined, who've maybe done a little bit more reading and who have sort of their set decision, that can definitely be a challenge. First, you want to partner with them and say, well, people who've, questioned vaccines, they have played an important role. Because as you mentioned, there were vaccines in the past, like the oral polio vaccine, for instance. There came a point in time where we had done such a good job at eradicating polio that there were actually more cases of polio coming from the vaccine than from, natural polio. So people who led the movement, they did help increase the safety of vaccines. And now we have a safe vaccine. We actually have an inactivated polio vaccine. So I do try to partner with them and say, look, this movement, has had some positivity. It does, serve as a safety type of second check. But now we do have these vaccines, and we do think that it's in your child's best interest to get vaccinated. You can also talk about, well, now, if you don't want to vaccinate your child now, think about them in the future. Think about when your child goes to college and they're interacting with all these people from all over the world. Think about when they want to travel. So you try to use whatever you can in your toolbox to try to find that hook that's going to be for that family, for that patient. And it's going to be a little bit different for everybody. And you're not going to have 100% success. But my belief is, at least if you open the conversation, you can keep talking about it. So maybe not on this visit, but maybe the next visit. They'll have thought about it and they'll have changed their minds. So I try not to give up on people that very first visit, or kind of close the doors off to them that very first visit, or come at them with a very you are doing the wrong thing type of attitude. I really just try to keep it like a open conversation, a partnership, such that they can at least think about it, and maybe they're not going to change their mind today, but they might change their mind in a couple of months.
Okay. This question is for both of you. We'll start with Dr. O'Keefe. Some children are unable to be vaccinated due to medical reasons. Is there any other method of, to help them because they can't be vaccinated?
Yeah, great question. There are certain types of vaccines where there's actually, or certain types of either virus or bacteria, that there's actually multiple types of vaccines. So if one population can't get one type of the vaccine, there might be another option for them. So that could be a good thing to introduce. Also, the kind of idea of herd immunity really does play, it's meant to kind of protect people who might be unable to get anything, any kind of immunity, or any kind of vaccine, I should say, against any disease. Hopefully, if we get enough of the people around them opting in, enough of the people vaccinated around them, they won't be as high at risk to be in contact with someone who actually has the disease. So really, there's the idea of kind of providing them with other options if they exist, and then hopefully getting the public to, educated enough to have a lot of people who are able to really using the vaccine.
Do you have anything to add, Dr. Cielo?
Sure. So there is what we typically talk about for vaccines. It's called active vaccination, meaning you inject something that requires an active response from the body. There's also passive immunization, which means that you're giving immunoglobulin that's already formed to fight the disease. So we do have immunoglobulin for certain diseases. Measles is one of them. So if someone who was unvaccinated or high risk, someone immunocompromised, who was exposed to someone who's definitely has measles or high suspicion for measles, it's indicated to give this immunoglobulin. So it's not requiring their body to come up with the immunoglobulin in response to a vaccine. You're just passively putting it in their body. But this only exists for a handful of diseases, and it's sort of less than ideal immunity because it's not their own body that's producing it. It's not going to be as strong of a response, and it's not guaranteed to work either. And it's a short-lived immunity. The immunoglobulin is probably in the body for about 3 weeks, give or take, so it's not going to give a long-lasting immunologic effect.
Okay.
And then, of course, there's treatment for disease. So if someone is already sick, you can try to treat them, but things like measles, there is no specific treatment. So often by the time the person has become ill, there's nothing you can really do as a physician except give them supportive care, and they don't all survive.
Okay. Dr. Cielo, since you are a pediatrician, children are on a vaccination schedule and are given more than one vaccine at one time. Is there any danger in receiving one vaccine versus several on the same day?
There is no danger. The immune system is exposed to hundreds of thousands of things in the environment. So our immune system is constantly reacting to things around us. So as young children, that's sort of the developmental stage of the immune system, where kids are sick more often, and it's because their body is sort of developing this repertoire of antibodies to fight off disease. And so when they're seeing things that their body has never seen before, they're going to become ill as they're fighting it off. But they're being exposed to many, many things. So we know that their body, just in the natural world, is able to respond very well to multiple different antigens at the same time. And they've definitely shown through lots, a big body of research that the children do just fine with multiple vaccinations in one visit. Their body is able to mount a great immune response. There's no harm that comes to the child. So I would say no, it's not dangerous to receive multiple.
Now, how things have changed since, previous years, decades. How many vaccines do children get now versus prior?
That's a good question. I couldn't tell you like the exact numbers, breakdown year for year, but definitely we've increased the number that we give children. So especially at like the 2-month, 4-month, 6-month visits, you can be getting as many as 4 or 5 vaccines, and even some of those vaccines might be combination vaccines, so there might be more than one antigen that's combined with the hope that you're giving fewer shots, fewer actual pokes. But to me, I feel like that's a really positive thing. Rather than a scary or worrisome thing, I think it's a really positive thing because it shows how far science has come. We've developed so much knowledge and so many ways to protect children from preventable diseases. So I think that's great that we have such a repertoire to offer our patients in terms of protection. And just kind of tacking on what you said before, the live attenuated vaccines, the killed vaccines, they go through years and years of studies before they come anywhere near to be approved for use, wide use. So there's many, many years of study and many, many years of testing that goes into each and every vaccine. And if it's not quite exactly where they want it to be, they'll keep going and they won't give that vaccine until they feel like it's absolutely safe.
Okay. And finally, briefly, can you both give me your opinion on how the digital age and the media have influenced public opinion regarding vaccines? We'll start with
Dr. O'Keefe. The digital age obviously has a lot of benefits, right? It could be easier to get information out there to people who, might be looking into these things. So the key is really one of the negative parts of the fact that everything is open access, everything is out there, is people might not know exactly where to go for legitimate health advice or health news. So before, they used to get those, that health news from simply their doctor. Now there's millions of websites they can go to. Some are reliable. So the Centers for Disease Control has excellent recommendations on, vaccines for travelers, for, the whole vaccine schedule. A lot of organizations have legitimate information. There are nowadays a lot of organizations and a lot of websites that make it really easy to get misinformation as well. So, and a lot of these websites have titles like, Vaccine Truth, or the truth about vaccines, or some kind of indication that if you didn't know what you were looking at, you might think, hey, this must be the truth, this must be what's out there, this must be the accurate information. So they're citing a couple different sources. I feel like it's a lot easier to get that anecdotal evidence. Before, maybe you just ask your neighbor something. Well, now you can go on lots of blogs and hear about horror stories that people might or might not be, accurately telling and linking in their own mind to a certain cause, right? So I feel like it's a lot easier to get access to kind of a lot of this misinformation that way. And it gives a lot of the people who have those very strong, very loud opinions, it gives them a lot more resources to use to get that information out there, which can be dangerous if the information is not really that scientifically evidence-based.
Okay, and Dr. Cielo?
I second that. Definitely technology is a double-edged sword. You want people to be able to read and be educated, but yet it's so much out there. So, I mean, my colleagues and I joke around that we're going to be replaced by robots, like you won't need doctors anymore. But I think that that is key to today's medicine, is that you really do need your doctor to help you piece through these pieces of information that are floating out there. So we need our doctors more than ever now to help us, read this information, direct us toward the good, reputable websites, help answer questions that we've formed after reading online. So I would still refer back to, your trusted physician to help you understand the things that you're reading.
Okay. Well, that's all we have time for. I want to thank you both for coming.
Thank you so much.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
You guys going to my party on Friday?
Yeah, dude, it's gonna be crazy.
All right.
What's up, dude?
I'm loving your jacket.
Don't be such a fag.
If you don't mean it, why say it? Words hurt. Think before you speak.
You love their music. Why would you steal it? When you illegally download your favorite band's music, they might just disappear. Downloading music without paying for it is just not cool.
Enroll, we say. We want you to be okay. Enroll, we say. Take care of people for goodness sake.
There's a plan for every budget, so don't accept defeat.
Now you can get covered and still
buy me treats. You take care of your pets. Now it's their turn to take care of you. Visit getcoveredamerica.org to learn about your health insurance options.
Thank you for watching. You can follow us on Facebook and Twitter at CSUN On Point. Sunday mornings, you can watch us on LA's Channel 36 at 11:30. And you can listen on KCSN 88.5 FM at 5:30. That's also Sunday morning. For all of us here at On Point, I'm Wahid Lodin.